Andrew is a PT student completing his clinical rotation at HHH Hospital. He is a high-performing student, and the department director has offered him a staff PT position after he graduates and passes the board exam. He was also invited to join a hospital-sponsored NPET study group with the added benefit that the hospital would cover his exam fee if he participated. During his first study session, Andrew noticed that the practice questions were not familiar and different to test preparation materials he had previously used. When he asked the facilitator and other students, he learned that these questions were created from previous NPET items submitted by former students that joined the group, which is an action that violates exam security. In this scenario, Andrew is experiencing ethical temptation. He clearly recognizes that using recalled exam questions is unethical and violates FSBPT policy. However, he is tempted to participate because of the personal benefits offered, including financial support for the exam and the prospect of future employment. The primary realm involved in Andrew's situation is the societal realm, because the actions considered directly after the integrity of NPET on a national level. Violating the exam security compromises the fairness for all test takers, weakens public trust in the competence of future physical therapists, and possibly threatens patient safety. Some moral principles in conflict with this situation include integrity, responsibility, beneficence, and veracity. Andrew is expected to act honestly, maintain ethical standards, and maintain his integrity, but this is challenged by the pressure to participate in a study group that violates exam security. Beneficence is also affected as compromising exam security could result in unqualified PTs becoming licensed, which may place future patients at risks. There is a legal implication in this case. According to the FSBT's guidelines on NPET exam security, all test takers are required to keep all NPET content strictly confidential. Failure to comply can result in dismissal from the test session, withholding scores, suspension, or a permanent ban from taking the exam, monetary penalties, and potential criminal prosecution. Using the standard practice for physical therapist assistants, standard number 5 states that PTAs shall fulfill their legal and ethical obligations. In this situation, that standard is clearly in conflict. Andrew is expected to follow federal regulations related to exam security. This means he is obligated to maintain the confidentiality and integrity of all NPET board exam content. By participating in the study group that uses recalled questions and that they are required to submit remembered NPET content, he would be violating ethical duty and the legal standards set by the FSBPT and federal law. In this situation, the most appropriate person to speak to is the Director of Rehabilitation, who offered the study group and the potential exam reimbursement and job. Using the DESC method as guide, I would speak with the director saying, I recently learned that the study group uses previous NPET questions that were submitted by previous test takers whose exams were paid for by the hospital. The SFBPT strictly prohibits sharing any NPET content and information. I would feel more comfortable if the study sessions used only approved study materials, discontinued the use of recalled exam questions, and stopped requiring students to remember content to report to the group. Making these changes protects the hospital from legal consequences, ensure that students prepare honestly, maintain ethical conduct, and protect patients from potential harm by preventing unqualified individuals from being licensed.